I was 31 weeks pregnant with my son Carson. I had been having kind of on and off fevers and illness symptoms, which eventually led me to the hospital in St. Cloud.
Just needed to go into the hospital and probably get some antibiotics and she would be fine. I mean, that was kind of our mentality.
I remember on the hospital ride to St. Cloud telling David, like, oh, this is the ramp we'll park in when we come back in 2 months to have a baby, but things went completely different.
Here's a young, pregnant woman who has severe aortic insufficiency. Her aortic valve is leaking a lot.
They came in when we got to Abbott and they said that you're having your valve replaced and that's the only way you're gonna make it through.
That we were gonna have to deliver her and simultaneously we were gonna have to replace this aortic valve.
And so that morning, we kind of there's three teams there. There's our open heart team, there's Dr. Wagner's team, and there's the neonatologists.
So we proceeded to cesarean delivery.
As soon as he was getting started, I was scrubbing, and the baby was out of the room before, as I walked up.
A nurse on the NICU team came out and said, do you want to come see him? Well, obviously, of course, we all did. And that was like basically the highest moment of my life.
At the time of delivery by cesarean section of the baby, Jamie had a complete cardiac arrest. It was a very quiet 58 minutes, but everybody knew, we knew, we had just delivered this baby for them. And we said, you know what? We're not going to let this happen.
Well, I remember him coming into the waiting room and he said, she crashed, we did CPR for a while, she's hooked up on ECMO. Things are somewhat stabilized, but we don't know if she's going to come out of it.
She stabilized to the point that we were pretty satisfied. And then it seemed like she acutely had a higher blood pressure. And so I kind of leaned in and I just, said her name. I said, Jamie. Can you hear me? She just nodded her head. And I said, squeeze my hand, wiggle your toes. There's a standard to this. So in my mind, I'm just like, oh my gosh, relief. So what I told her, I said, Jamie, your baby's fine. Because I wanted her to know that.
After that, David had come in, and it was actually Valentine's Day, the day that I woke up. And he had a little blue bear to tell me that we had a boy.
10 years ago, Jamie would have been a statistic, a very sad statistic.
Hey, buddy.
Research helped us understand what tools we needed. Research educates us on how to approach these problems, and then we can be better.
Having utilized that research myself, I now have such a greater appreciation for it, because without the research, I wouldn't be here to be a mom to Carson.
The nurses were amazing. I think they went above and beyond in a lot of days to help Jamie and myself.
The surgeons we had, Dr. Wagner was the one who brought Carson into the world, and Dr. Sun saved my life, and I don't know how you thank somebody for that.